Hi, everyone, and welcome to our Kapnick Strive June webinar, where today we'll be talking about post-traumatic stress disorder, or PTSD. My name is Emma, and I'm a wellness coordinator on the Kapnick Strive team, and I also have 3 other members of our Kapnick Strive team with me today who will also be speaking throughout the presentation. So we have Emma D, we have Jen, who is our newest team member, and we also have Ashna, who is our summer intern. So jumping right into it today. Before we get started, I just want to give a little content warning about some of the topics we'll be discussing today. So because the topic is PTSD, we will have some mention of topics like sexual assault, violence, traumatic events, depression, anxiety, and suicide. So if any of those topics might cause you some concern, feel free to either jump off momentarily or kind of silence it as we go through. So making sure we're all on the same page here with some standardized definitions of what exactly PTSD is. So post-traumatic stress disorder is a psychiatric disorder that may occur in people who have either experienced or witnessed secondhand some sort of traumatic event. It's a prolonged and repeated experience of trauma that can manifest in a lot of different ways. So PTSD has been known as different things throughout the years. It's been called shell shock during the years of World War I and was also called combat fatigue after World War II. But PTSD doesn't just happen to combat veterans. It can occur in all people of any ethnicity, nationality, culture, and it can also occur at any age as well. So with mental health disorders, it can be kind of difficult to visualize what's actually going on inside of the body and going on inside of the brain that's causing these symptoms and this experience of PTSD. So PTSD is actually a result of internal glands in your brain adjusting to various levels of neurotransmitters. So starting off with the amygdala, this actually acts as our body's sort of alarm system. So that triggers our fight or flight response when we're in some sort of dangerous situation or in a perceived dangerous situation. So when someone has PTSD and is experiencing PTSD symptoms, this gland is actually going into overdrive and it's really overactive. So at the same time, your prefrontal cortex, which is at the front of your brain, it typically helps to reel that response back and get you to calm down a little bit. So the purpose of that prefrontal cortex is to help you think through decisions, observe how you're thinking, and also put the brakes on when you realize that something you first were really fearful of isn't actually a threat after all. So kind of going through that response of saying, oh, wow, I had this kind of fight or flight or fearful response first, but now this prefrontal cortex is helping me reason through the situation. I can see now that I'm not actually in danger. So typically, that's how the prefrontal cortex works, is it helps us regulate those emotional responses that are triggered by the amygdala or that alarm system in that brain. But people who are experiencing PTSD don't get the same level of regulation. So that's why, folks with PTSD can experience those constant feelings of panic, even if there's not a direct, real threat in front of them. All right, so I'm going to pass off the next few slides to Jen now.
Thank you. So carrying on, what is it that it feels like, or what can it feel like? An overactive amygdala combined with that underactive prefrontal cortex, as you saw on the last slide, creates this perfect storm. It's as if you're slamming on your car's accelerator when you don't need to, and then discover that the brakes don't work. So this kind of ramping up happens. This might help you understand why some people with PTSD feel anxious around anything that's slightly related to the origin of the trauma. People with PTSD might have strong physical reactions to situations that shouldn't provoke a fear reaction, and they could also avoid situations that might trigger those intense emotions and reactions. That gives you a little better feel. When we look at causes, there are a large variety of causes that can lead to PTSD. Not everyone with PTSD has been through a dangerous event. Some people develop it after a friend or family member experiences danger or harm. The sudden and unexpected death of a loved one could also lead to PTSD. And then the most common are listed here for you. So those are combat exposure, childhood abuse, that can be emotional or physical or sexual abuse, sexual harassment or violence, and then finally exposure to accidents such as car accidents, natural disasters, terrorist attacks, and more. The factors that play a part in whether a person will develop PTSD vary. It's important to understand that you don't necessarily have to experience the trauma with your own eyes. The exposure could be indirect rather than firsthand. So for example, PTSD could occur in an individual learning about the violent death of a close family member or friend. It could also occur as a result of repeated exposure to horrible details of trauma, such as a police officer who is exposed to the details of a child abuse case. And how do you know if this is something that you need to be concerned with for yourself? A diagnosis typically means the following criteria are being experienced by the patient. So we will walk through each of these in detail. And if you experience one of each type for over a month, you may be at high risk for PTSD and should definitely seek advice and speak with your doctor immediately. So starting with the first, it is re-experience symptoms. Re-experiencing symptoms can cause problems in a person's everyday routine. The symptoms can start from the person's own thoughts and feelings, or words, objects, and situations that are reminders of the event can also trigger the re-experiencing of those symptoms. Examples of this include flashbacks, which can often be accompanied by increased heart rate, sweating, trembling. You might also see bad dreams or nightmares, frightening thoughts, episodes of anxiety surrounding the activity that may have related to the traumatic event. And now Emma D is going to carry on.
All right, thank you, Jen. So up next we have avoidance symptoms. So these avoidance symptoms can be triggered by anything that can remind a person of that traumatic event. These symptoms may cause a person to change their personal routine, which causes an interruption in their day-to-day life. This can look like taking conscious or unconscious efforts to avoid physical spaces related to the trauma, places where the trauma has occurred or places that remind a person of it. It can also manifest in avoiding the use of certain objects that are related to the trauma, or even throwing out anything that reminds you of it. And then finally, avoidance of thoughts and feelings is another example where you may find yourself trying not to acknowledge any emotions surrounding your trauma, or just kind of blocking out those thoughts and feelings. So for example, kind of looking at avoidance symptoms as a whole, so a traumatic car accident could result in avoidance of the spot of the crash, the physical location where it happened, and that could be conscious or unconscious. That could look like, I don't want to drive down that road because I know it's going to remind me of the car accident, or it could be unconscious, and maybe 5 years have passed until you realize you never drove down that road again and you figured out a different route. This can also look like, after a car accident, maybe a fear of riding in cars, so having a fear of that material object that's associated with the event, or just blocking out thoughts about the accident at all, or almost kind of telling yourself that it didn't happen. That's pretty common. So those are avoidance symptoms to look out for. Next up are arousal and reactivity symptoms. These are usually constant, and it's kind of an overall agitated state. So as opposed to being triggered by things that remind you of the traumatic events, these symptoms can make you feel stressed and angry, They can make it hard to do daily tasks, such as sleeping, eating, or concentrating. And then examples just include just overall feeling more easily startled, tense, and on edge. Like I said, having sleeping issues, so falling asleep, staying asleep, but also having recurring nightmares can also be a symptom, or having frequent outbursts of anger and also panic attacks. I will say with panic attack disorder is fairly often comorbid with PTSD. So if you're having these symptoms with some of the others like we've been talking about, do talk to your healthcare provider. And then lastly, for this kind of going over the symptoms, are the cognition and mood symptoms. So these can begin or worsen after the traumatic event, but are not necessarily due to injury or substance use after. So these symptoms can make the person feel alienated or detached from friends or family members. So it's kind of like they're living in a detached, different reality. Examples include memory clouding, where the body and mind will attempt to cope, which may lead to you remembering events in a distorted way or a different way than they actually happened to make them more easy to process and live with. Another symptom is having just a negative outlook about yourself and your surroundings. This is a byproduct of trauma, and this can also manifest in cases of depression. And then finally, a state of confused and distorted emotions can arise due to unaddressed and growing guilt and blame that people may feel. And then this can also always constantly shift as you attempt to process your trauma. So these are just the cognition and mood symptoms to look out for. And now I will be passing it over to Ashna.
Thanks, Emma. So we often hear that time will heal things like this and that you just get over it. But PTSD is a severe diagnosis, and whatever you're feeling or whatever you experienced is valid. And if left untreated, this can lead to other major health consequences. That's why it's so important to make sure that you speak to your primary care physician or healthcare provider immediately if you feel as though you experience any of the symptoms we've discussed so far. Untreated PTSD has been associated with increased cases of depression, anxiety, issues with drug and alcohol abuse, eating disorders, and suicidal thoughts. You might be wondering how common it is to experience PTSD. It's a lot more than you might expect. 1 out of every 11 people will be diagnosed with PTSD in their lifetime, according to the National Institute of Mental Health. Studies have estimated that roughly 44.7 million people are currently have or have suffered from PTSD as of today. It is also notable that women are twice as likely to have PTSD as men, which sometimes comes as a surprise given PTSD's association with military experience. And they're more likely to go untreated. Latinos, African Americans, and Native Americans are also disproportionately affected by PTSD as well. Luckily, lots of research and expertise has gone into finding ways to treat PTSD and lessen the burden of its symptoms. Treatment for PTSD can fall into 2 main categories: psychotherapy and prescription medication. The most studied type of medication for treating PTSD are antidepressants, which might help control PTSD symptoms such as sadness, worry, anger, and feeling numb inside. Other medications may be helpful for treating specific PTSD symptoms such as sleep problems and nightmares. Doctors and patients can work together to find the best medication or combination of medications, as well as the right dose. Psychotherapy, which is also sometimes called talk therapy, involves talking to a mental health professional. This can occur one-on-one or in a group and lasts usually from 6 to 12 weeks or more, depending on your situation. One helpful form of therapy is called cognitive behavioral therapy, or CBT. This can include exposure therapy, which helps people face and control their fear by gradually exposing them to the trauma they experienced in a safe way. Then you have cognitive restructuring, which helps people make sense of the bad memories. Sometimes people remember events differently than how they happened, and they might feel guilt or shame about something that's not their fault. The therapist helps provide people with PTSD to look at things, how they happen in a realistic way. Whichever path you choose, be sure to talk to your doctor and know that these treatments are gradual and not immediate. To supplement these, you can also incorporate small lifestyle changes to aid recovery. This can be through physical exercise, seeking out and confiding in loved ones, and seeking out comfortable spaces. It's also important to be prepared to support loved ones who might be experiencing PTSD. So here are a few tips on how to navigate that. The first thing you can do is to provide social support. This is through being patient and not imposing any pressure on a loved one to discuss their issues, but giving them the time and space, doing positive things to make them feel safe. This can be frustrating and difficult at times, but it's really necessary to show your loved one that you care about their healing. Secondly, when your loved one is ready to talk, make sure to be a good listener. Your loved one might need to talk about their trauma multiple times, which is just part of the healing process. So let them repeat themselves and explore their thoughts and feelings. Some of the things your loved one tells you might be very hard to listen to, but it's important to respect their feelings and reactions. If you come across as disapproving, horrified, or judgmental, they might not open up to you again. Try to avoid statements such as everything will be okay. Try to avoid giving unsolicited advice or make your loved one feel weak or imply that they should feel lucky or grateful for their survival. Another tip is to rebuild trust and promote safety. Express your commitment to the relationship by minimizing stress at home, making future plans, keeping promises, and emphasizing your loved one's strengths and empowering them. Finally, you can anticipate and manage triggers. Decide with your loved one how you should respond when they have a nightmare or a flashback or a panic attack. Having a plan in place will make the situation less scary for the both of you, and you'll also be in a much better position to help your loved one calm down. I'll pass it back to Emma B.
Awesome. So we have a few different resources listed on this slide if you're interested in learning more about trauma. We have a book which is called The Body Keeps the Score, a TED Ed episode that you can watch on YouTube, which is called The Psychology of Post-Traumatic Stress Disorder, and also this Anxiety Coaches podcast. Anyone have anything to say about resources on the slide?
Yeah, actually, I can't emphasize enough how good the book is, The Body Keeps the Score. I know for me, a lot of my anxiety symptoms and, experience of traumatic events will manifest physically. And I think that happens for a lot of people as well. And so you might not even be, recognizing what your body is exhibiting is actually kind of a clue into the state of your mental health. So the book just kind of talks about that, and I just really recommend it.
Yeah, thanks, Emma. Mm-hmm. All right, all. So we're wrapping up early today, so you get 10 minutes of your life back. But our next webinar for July is going to be talking about vision and eye health. I know this topic is, really relatable for a lot of us, even folks who don't wear glasses or contacts. We'll also be talking about how to keep your eyes healthy, especially if you are working in a position where you're looking at a screen all hours of the day. So that will be taking place on the last Wednesday of July, so July 27th, from noon to 12:30 p.m. Eastern. So we look forward to seeing you all there.